one of the topics is like, well, what can physicians do to just make more money? Switch jobs. I mean, this is true across any job, across the economy, any industry. Job switchers make more money. And it's like 30%.
Welcome to How I Doctor. We're bringing joy back to medicine. My guest today is Dr. Eric Bricker. Eric is probably best well known for his big personality and brilliant explainer and analysis videos that he produces for his company, A Healthcare Z. You can find them all over social media with his unique style of whiteboard drawings and professional passion and excitement. Dr. Bricker provides insightful commentary and a fascinating lens for physicians to better understand healthcare finance, healthcare economics, and how these factors trickle down to influence of doctors day to day and what happens to their patients. Thank you so much for joining me today, Dr. Eric Bricker.
Oh, Graham, listen, thank you so much for having me. And I love the intro of bringing joy back to medicine. I think that's great.
We need it. Thank you. Eric, I love that I'm actually seeing the background of what I see in your videos when I watch them all the time.
Yeah.
Where did the idea for A Healthcare Z and the videos come from?
Before I became a physician, I was actually a hospital finance consultant. So I would help doctors and hospitals get the bills paid back in the 90s, back when it was like paper bills, and still wanted to become a physician and wanted to really help solve because it was a billing disaster back in the 90s and it's a billing disaster today. Like nothing's changed. And so I really wanted to try to help like solve some of those problems that I saw prior to going to medical school, like in my career as a physician. So went to University of Illinois for medical school and then Johns Hopkins for residency in internal medicine and actually started a healthcare navigation company in residency and then outside of after residency as well. It was called Compass Professional Health Services. And we would contract with employers to provide basically like outpatient care coordination, like insurance coordination, basically all the stuff that like a primary care physician doesn't get paid to do. They don't have time to do. Sometimes they just don't do it. You can actually get it through your job. So like if you got so like Southwest Airlines is one of our customers. So if you were like a pilot or a flight attendant, you'd be like, okay, you'd have this like care navigator through your job that would help you with your insurance and your doctor and your hospital stay, et cetera, et cetera. And we grew that to about 2,000 employer clients and 1.8 million people. And then we sold that business in 2018. And so to specifically answer your question, when I was sort of free and I was no longer a part of Compass, I'm like, okay, well, I'll just start making these videos as like a hobby so I could kind of shoot people straight and I could give people kind of the good, bad, and the ugly for the insurance companies, the docs, the hospitals, the pharmaceutical industry, et cetera. Because I wasn't beholden to anybody. And I could just say, hey, my point of view, kind of how do I see things? I'm like, hey, I'm just going to try to shoot people straight with what I've experienced.
Eric, you have such a unique style in your videos. Why the whiteboard? It's totally become your brand and your style. I immediately know an Eric Bricker video.
One of my favorite people is Linus Pauling. And he's famous for having won two Nobel Prizes, one for peace and one for chemistry, I believe. And so one of Linus Pauling's quotes is the best way to have a good idea is to have a lot of ideas. And so I was like, okay, the best way for me to have like a good video is for me to have like a lot of videos.
How do you pick your topics, Eric?
My inspiration is infinite. And instead of it being like Sports Center on ESPN, where it was like, okay, well, this happened and this happened. It's like, okay, well, why is this happening? So I'm kind of getting into like kind of how the game is played and what's going on behind, quote unquote, behind the scenes, because that's the real mystery of quote unquote healthcare. It's like a duck where you just see the duck on the surface, but there's all this stuff going on underneath the water. And the reason why I focus on healthcare finance is because all that stuff that's going on underneath the water is the money. If we could like do some things around how the money flows in medicine, I think it would dramatically improve patient care. That's why I talk about this stuff.
It's really important, Eric. That's something that I think you're unique because you are speaking with your medical knowledge and your medical training. And that's something that none of us get any training in. Maybe we get a little bit of an elective.
Yeah, and I honestly think that medical training actually sets up very well for this because at the end of the day, I think all physicians are kind of autodidacts, right? To a certain extent, if you're a physician, you kind of have to learn how to learn, right? And that's because nobody finishes medical school, nobody finishes residency like knowing everything they need to know. But we as doctors need to understand that quote, I just want to be a doctor and I just want to see patients. that that doesn't work because the money is so impactful in patient care. And so if we really want to help our patients, we can't just be a doctor and just see patients, that we have to understand how that money flows and how it impacts our patients so that we can help them better. In my opinion, we will be better doctors and we can help our patients better if we understand this, not as a hobby, not because we're curious about it, not because it's going to help our own income, but because specifically it's going to help our patients more if we understand this better. So that's why I have gobs of physicians that watch my videos and call me all the time and are like, hey, this resonates with me. And let me tell you about what's going on here and what's going on there. So I get calls with inside stories all over the place from doctors all over the country.
Eric, if all physicians or many more of us had a better understanding of the money, what what would we do with that information? Would we be advocates or lobbying or more just play the game better?
So one would be like around like prior authorization. Okay. And at the end of the day, guess what? If you want something prior auth, like you will get it approved. Okay. So like a number one for prior auth is that like the vast majority of the time, if you want the stress test or if you want whatever, like guess what? You can get it. Okay. And so it's a matter of understanding that and then understanding that, okay, yeah, maybe you're going to have to delegate that to maybe an MA or a nurse or whatever. And you're going to have to go through, so you've got to be persistent and blah, blah, blah. But at the end of the day, like you can totally do it. Like, and so that's like the little secret that like insurance companies don't tell you because of course the protocol is like just I mean they've literally caught them this. They're like they're going to deny everything too. Okay, what else? This whole non-compete thing is a bunch of garbage. Okay, at the end of the day, like you as a doctor, like you can and you should leave your job and you should go across the street to the competing hospital system. Like just do it, okay? And be like, what are you going to do?
Because the hospital's not gonna actually do it.
Right, and guess what? Yeah,
Yeah.
maybe you gotta get a lawyer.
Yeah.
Like, it's not like getting sued is not the end of the day. It's like you get a lawyer, they'll drop it, vote with your feet, and just do it. And they'll try to intimidate you to not do it, but just freaking do it, okay? And so this is true. So, like, one of the topics is like, well, what can physicians do to just make more money? You switch jobs. I mean, this is true across any job, and across the
In
economy.
the industry, I think. Yeah.
Any
Yeah.
industry, job switchers make more money, and it's like 30% more.
Wow.
And because people are always looking for I mean, people are
Yeah.
always looking for
Especially now. Yeah.
Yeah,
Yeah.
and they're like and then people are so scared to leave. Dude, just leave. Like, you'll be okay. Like, I got my student loans to pay back. Just leave. I got my kids' college savings to take care of. Like, just leave. Okay. I mean, it's not like you will find a job, you will be okay. It's really the fear, false evidence appearing real. You just got to have the courage to just get over that and you just got to walk. Physicians are basically lied to by insurance companies, they're lied to by administrators. If you don't want to use the word lied to, they're manipulated. So the point is that if you actually understood how the money works, then a physician will be much less easily manipulated.
How does that make you feel, Eric, when you come to these realizations? Do you feel we've been taken advantage of all along, or have things changed over time?
Oh yeah, we've totally been taken advantage of. We kind of get used to not pushing back. And then in residency, we don't push back. And so we've been trained to like not push back. I've even had hospital administrators admit this to me that whenever they need the physician to like work more hours or see more patients, they essentially intentionally guilt trip them into being like, but this is for the patient. They literally told me, yeah, that's a strategy we use to manipulate physicians.
I think Danielle Offrey had a piece in the New York Times that I always think about where she essentially said the Hippocratic Oath is abused in that, doctors and nurses have decided to go into medicine for these hopefully somewhat altruistic reasons. We take this oath that says we're going to put our patients above us, and then the system uses that oath that we said we were going to put patients first to get free labor, work extra hours
Oh yeah.
in the name of the patient.
That's right. And also I just want to add too, it's not just the quote unquote system, it is specific people in positions of power. Okay. So people are always like, well, we don't like to point fingers. No, no, there are people who are consciously
Point them.
sitting in rooms making these decisions.
I want to transition a little bit to what's happening with physicians now. I'm seeing more physicians wanting to leave medicine, begging to leave medicine, or just do something else, whether it's a side gig or cut back on their clinical hours. How did we get here?
So one, the reimbursement complexity has has really continued to get worse and worse to the point where just the denials and the non-payment and the delayed payment for the independent physician was overly onerous so that they essentially had to sell their practice because they couldn't bill and collect. And then the other reason why is because the professional fee reimbursement is just so low compared to the facility fee reimbursement because the big hospital systems have the negotiating power from a commercial insurance, so from like a employer sponsored insurance plan, right? So this is the classic thing of like the orthopedic surgeon is like, well, maybe I'm getting $750 for the professional fee for the arthroscopic knee surgery. Like that hospital could be getting anywhere from 16 to $32,000, and the doctor's getting 750. The surgeon's getting 750. The anesthesiologist is getting 1,100, and the hospital's getting 32 grand. And it's just because of the negotiating power that the hospital has for that. And then what really added kerosene to the fire in the last 5 years was the explosion of Medicare Advantage. Because historically, physicians still had traditional Medicare where you didn't have prior authorizations. And if you did it, you would get paid relatively quickly. You do it, you get paid. You do it, you get paid, right? And that kind of existed, right? But that was when only 20 to 25% of people on Medicare were on Medicare Advantage, and now it's over 50%. And that trend is it's going to go up to at least 75% that are on Medicare Advantage. So all the problems with delayed and denied payment that used to not apply to your Medicare population, now it does apply to like the majority of your Medicare population. And so you definitely have, proceduralist doctors, cardiologists, orthopedic surgeons, neurosurgeons doing spine, radiologists. I mean, those professions that I just mentioned, like they're making money hand over fist. Like they're in this new environment, they're making more money than they ever have in the past, especially and then geographically, especially in the South and the Midwest. These folks are easily pulling in over $1 million a year.
Because the facility fees are so high, and so then the hospital can give them a nice chunk of that?
That's right. These hospital systems sometimes are making like $10 million per neurosurgeon. So they're like, yeah, we'll pay the neurosurgeon $1 million because we're making 10 million off this guy or woman every year.
Eric, are there other practical things that doctors can do to respond to the changes we've seen over the past couple decades to whether it's, to improve their salary or just improve their quality of life of finding a better place to work?
Yeah. So you're either gonna walk, right? Or you have to act. The other thing too is you have to actively ask for raises. Guess what happens? People who ask for raises get raises. People who don't ask for raises don't get raises. So you need to ask. Like,
Yeah,
and you don't ask
that's
once
great.
a year. Shoot, ask twice a year. Ask 3 or 4 times a year. Ask multiple times a year and be like, look, I want a raise. And if you're not willing to give me a raise, I'm willing to leave. And so you can either leave, you can threaten to leave and ask for a raise. And then the third alternative is you unionize because there are some places where they're like, well, there's just not enough options here. And so we just need to unionize. And we see this with doctors and with nurses. With doctors, it's been primarily the residents that are starting to do it. And these residents are making a lot more money than they used to make. They're getting, much better working conditions. And it's actually not that hard to unionize.
It's always felt to me that physicians, we tend to circle the wagons around our own specialty, but do you get a sense that physicians are becoming more open to that idea of like we're stronger together?
Unfortunately, I think the answer is no. I think we are still heavily balkanized by specialty because, to a certain extent, while we're all doctors and we take care of patients, like our practices and our patient population, like a dermatologist and an orthopedic surgeon actually have very little in common. I mean, they're both doctors, but like kinda. I mean, they're super different. It's like one guy's a plumber and one guy's an electrician. Like, that's really different, okay? Like, yeah, they both work on houses and buildings and stuff. Like, it's hugely different jobs that you have. And I don't think we're going to overcome that. And actually, that's really been the reason why everyone's like, "Oh, the AMA is terrible." Listen, it's not the AMA's fault. I mean, each physician is so married to their individual specialty society, whereas the American Hospital Association is actually quite unified for all the hospital, and it's been all this uncoordinated effort from a political advocacy standpoint. Whereas from the hospital standpoint, it's been highly unified, which is why I actually, from a practical standpoint, I'm like, look, don't rely. Healthcare improvement in your life as a physician is not going to come at the federal level. Okay. It's going to come at the level of your own practice, of your own hospital, of your own county, and maybe your own state. And that's it. So if you want to focus, start incredibly local because PBMs have very organized and effective federal lobbying. Okay. Doctors are not going to beat that.
Is there a way that a physician can get a sense for how much the hospital is billing under their NPI or their name? Like, is that
Yeah.
something that a doctor can figure out?
So the short answer is yes. And you know which group of physicians that I feel like does the best job of this is radiologists. Because radiologists, they know their RVUs cold. And the key to making money as a radiologist is your RVUs. Because if you're churning and burning reading, you're literally generating 22,000 to 24,000 RVUs per year. Okay? A primary care doc is generating 4,000 RVUs per year. Okay, so just the economics of the way that you read films, you're just cranking out RVUs like crazy. And you talk to the finance people within the hospital. Again, you got to be persistent. You got to know who to talk to. Yeah, yeah,
This is part of asking for a raise, is explaining your
yeah.
value
But
to.
believe
Yeah.
me, all the radiology groups that contract with hospitals, they know exactly what what the hospital's getting reimbursed per RVU. And what I've really found is that the radiologists, they tend to be good business people because they're very rational and they tend to be dispassionate. They're good at numbers. They tend to be like engineers, and they're very good at just looking at this and just putting together the numbers on a spreadsheet. I mean, shoot, there's a lot of doctors that don't know how to use a spreadsheet, right? What is something that you can do as a doctor? You need to know how to use a spreadsheet. Okay. And as an autodidact, you need to be able to figure out how to build your own spreadsheets and being able to figure out and track your own RVUs and how you're getting paid or whatever. So in terms of like individual agency and keeping track of stuff, you got to keep track of your own. Like if you want to make more as a physician and you're not doing your own spreadsheeting, then the first thing you need to do is do your own spreadsheeting.
Yeah.
Because guess
Get
what?
your own house in order. Yeah.
That's
Yeah.
right, because that's what other people in other industries do. Like, that's what engineers do. That's what people who work in investment banking do. Like, that's what people who run small businesses. Physicians used to be small business owners. Physicians used to run their own small practice as a small business. Like, you need a spreadsheet.
Hi, it's Dr. Graham Walker, co founder of Offcall and host of How I Doctor. Are you unhappy with your pay or wonder if you're getting a fair shake? Offcall is here to bring transparency to medicine so you can finally understand if you're being paid fairly. Visit offcall.com/salary to get started. Explore our anonymous and accurate compensation data from real doctors to compare your salary and benefits to others in your specialty. Go to offcall.com/salary to sign up. Real change starts now. Eric, we only have a few minutes left. I've got some rapid fire kind of
Okay.
quasi medical questions for you. Whatever comes to your mind. What's the number one thing you wish patients knew about you?
This is going to get a little philosophical. That the metaphysical dominates the physical. We live in a metaphysical world that dominates the physical world, and you can experience that metaphysical world through whatever spirituality or religion that you would like. But if you understood how the metaphysical dominates the physical, your life would change so much more for the better.
Wow. I never expected to hear such a line from an analytical Eric Bricker. I absolutely love that. Eric, what's the best financial advice you think you've ever received?
Oh, well, this doesn't come from me. This comes from Ben Franklin, and that is spend less than you make. So, everyone has probably heard the book Millionaire Next Door, and there are these people that are referred to as poor accumulators of wealth. And a number one example is physicians because they tend to spend more than they make. And so take whatever it is that you're making and spend less. And so that house that you buy, like literally buy a house that's got like kind of smaller square footage, right? And the car that you buy, like don't buy the big flashy car. And yes, the other people that you know that are your peers that are in your age group, like they're going to have fancier cars and bigger houses and they're going to go on fancier vacations and we're not going to do that.
Eric, I talk a lot about AI as well. Have you thought of what you think will be the big use case in AI that changes medicine for the better?
I already think that the natural language processing and turning that with AI into a note is a real game changer because the documentation it's a bear, right? That, in my opinion, is a huge game saver to the extent that you can actually have it just listen in on your conversation and generate the note for you. I mean, that's fantastic.
Eric, if you could design or create a new medical specialty, what would it be?
The serious oncologist for serious stuff because there's a huge spectrum of like ductal carcinoma in situ for breast cancer versus
Oh,
like
okay.
serious oncology. It's just like with primary care, you got to be triage or with emergency medicine, right? You got to triage them in and be like, do they need to be admitted? Right. And the equivalent is, okay, I'm a community oncologist or whatever. And it's like, okay, you need to be admitted to the serious oncologist.
Do you have a lesson from a mentor, an attending, someone that still shapes how you think about medicine or think about the world?
Well, every single attending I had at the University of Illinois at Chicago really told me the patient comes first always. I mean, that was really ingrained in me. And then I got to Hopkins, and like every single attending physician at Hopkins was like, the patient comes first. And that might be true at all medical schools and all residency programs, but that was definitely true where I trained.
And then Eric, last question. One medical myth that you wish would disappear forever.
I guess one is that people just need to understand T cell clonal expansion. Be like, look, it takes 3 to 5 days for your T cells to kick in. But when your T cells kick in, they are amazing. Okay. So I get that you're not feeling good now, but just if you just knew what your T cells could do and the fact that it takes 3 to 5 days for them to kick in, just just give your T cells a chance because they will blow this viral thing out of the water so good that you just got to chill till those T cells start working.
Well, Eric, where can listeners find you and help support the work that you're doing? What's the best place to find you?
If you're on LinkedIn, just connect with me on LinkedIn, Eric Bricker, and then also to the A Healthcare Z channel on YouTube. So if you want to see videos or subscribe, that's where you can go.
Dr. Bricker, thank you so much for your time today. It's been absolutely great to have you and get to connect with you.
Thank you, Graham. And thank you for everybody for listening.